Tezacaftor-Ivacaftor in residual function heterozygotes with cystic fibrosis. Definitions. Cystic fibrosis is an autosomal recessive disease caused by mutations in the CFTR gene that lead to progressive respiratory decline.
In lung airways and passages in other organs, cell surfaces have tiny proteins called CFTR. These act as channels for chloride ions to regulate the movement of salt and water in and out of cells. In cystic fibrosis, this process is disrupted because of a mutation or error in the CFTR gene, which provides the instructions for making CFTR protein channels. As a result, thick, sticky mucus builds up in many organs. Some CFTR mutations can cause what's called a gating defect, where the CFTR protein channels are present at the cell surface, but fail to open correctly. Kalydeco is designed to keep CFTR protein channels at the cell surface open longer, to improve water across the cell membrane. Indication and important safety information. And older who have a certain mutation in their CF gene called the G551D mutation. Kalydeco is not for use to other mutations in the CF gene of the F508del mutation in the CF gene. It is not known if Kalydeco is safe and effective in children under 6 years of age. Kalydeco should not be used with certain medicines, including the antibiotics rifampin and rifabutin, seizure medications, phenobarbital, carbamazepine, or phenytoin, and the herbal supplement St. John's wort. Kalydeco can cause serious side effects. High liver enzymes in the blood have occurred in patients taking Kalydeco. Regular assessment is recommended. The most common side effects associated with Kalydeco include headache, upper respiratory tract infection or common cold, including sore throat, nasal or sinus congestion, and runny nose, stomach or abdominal pain, diarrhea, rash, nausea, and dizziness. These are not all the possible side effects of Kalydeco. Patients should tell their healthcare providers about any side effect that bothers them or doesn't go away. Please see full prescribing information for Kalydeco at www.kalydeco.com.
Applications in medicine. Vertex Pharmaceuticals, a clinical stage biopharmaceutical company, recently announced that 2 phase 3 studies evaluating its Tezacaftor-Ivacaftor combination therapy have shown statistically significant and clinically meaningful improvements in lung function in patients with certain mutations associated with cystic fibrosis.
Brain conductance regulator, or CFTR protein, is located in the apical membrane of cells lining the airways and also can be found in other areas of the body, including the sweat glands, intestinal, reproductive, hepatic, and renal epithelia. The CFTR protein facilitates the transport of chloride into and out of cells. CFTR is a complex glycoprotein composed of 1,480 amino acids. CFTR has a regulatory domain that contains phosphorylation sites. The CFTR protein has 2 nucleotide binding domains, NBD1 and NBD2, and 2 transmembrane domains, TMD1 and TMD2. The movement or conductance of chloride across the CFTR protein requires phosphorylation of the regulatory domain. In addition, binding and hydrolysis of ATP are required for the opening and closing of the CFTR channel. This process is also known as gating of CFTR. The CFTR gene is located on the long arm of chromosome 7. Under normal circumstances, the DNA is read and transcribed to messenger RNA, during which the introns are spliced out. The messenger RNA strand exits the nucleus of the cell and travels to the ribosome, where it is translated to the immature CFTR protein product. In the endoplasmic reticulum, or ER, other proteins called chaperones help to fold the protein. CFTR is then transferred to the Golgi apparatus. From the Golgi, transport vesicles are created and the CFTR protein is transported to the cell surface membrane. This process is also known as trafficking of CFTR. Different CFTR mutations cause disruptions at various stages of CFTR protein synthesis or in several aspects of function. Mutations that cause a splicing defect result in CFTR messenger RNA that is not properly processed. Although some functional protein may be produced, the amount of CFTR at the cell surface is decreased in comparison to normal levels. Premature stop codon mutations prevent full translation of mRNA, resulting in truncated CFTR, which is not functional and never reaches the cell surface. Other CFTR mutations, including the most common one, F508 deletion, affect post-translational folding and transport of the CFTR protein to the cell surface, also known as a trafficking defect. These misfolded proteins are retained in the endoplasmic reticulum and degraded. The result is that only a small quantity of CFTR protein reaches the cell surface.
The pros and cons. Tezacaftor-Ivacaftor was also very well tolerated, which makes it an important potential new option for helping patients feel better and change the course of their disease. The fact that Tezacaftor-Ivacaftor will be the basis of triple combination therapy makes this positive data even more exciting for patients with CF and the physicians who care for them. Taylor Kaiser added. Pros. The combination showed good safety results with the majority of adverse events reported as mild or moderate. This included pulmonary exacerbation, nasopharyngitis, cough, and increase in sputum and headaches. The rate of adverse events was similar between the placebo and Tezacaftor-Ivacaftor groups. Primary endpoints were safety through day 56 and change in sweat chloride from baseline through day 28. Secondary endpoints include a change in percent predicted FEV1 from baseline through day 28 and pharmacokinetics. The incidence of adverse events was similar across treatment arms. In some patients, the results were not the expected ones. Issue applying in Ecuador. In Ecuador, the results are particularly exciting because they demonstrate that by addressing the underlying cause of cystic fibrosis, The Tezacaftor-Ivacaftor combination offers significant benefits for many people with this severe and life-shortening disease, while also offering increased benefit over Kalydeco alone in patients with residual function mutations. In conclusions, the results support clinical development of Tezacaftor 100 milligrams per day in combination with Ivacaftor with 150 milligrams per 12 hours in subjects with cystic fibrosis.
Chemistry is the driving force behind many aspects of life. Although it's not always apparent, chemistry is the foundation for much of what we do. From new materials to medicinal therapies, chemistry is all around us. Tonight we honor Vijaya Lakshmi Arumagam, Brian Baer, Peter Brutenhuis, Sabine Adida, Anna Hazelwood, scientists from Vertex, whose innovations have led to developing Kalydeco, the first medicine to treat the underlying cause of cystic fibrosis. Cystic fibrosis affects about 30,000 people in the United States and 70,000 people around the world. It's a genetic disorder that harms the lungs and other organs and can ultimately lead to an early death. It's caused by a defective or missing cystic fibrosis transmembrane conductance regulator, or CFTR protein, that results from mutations in the CFTR gene. CFTR proteins regulate salt and water transport throughout the body. When the CFTR protein is missing or defective, thick, sticky mucus builds up and blocks the passages in many organs. There are more than 1,800 known mutations in the CFTR gene. In the US, about 4% of those with cystic fibrosis, roughly 1,200 people, are believed to have the G551D mutation. Kalydeco is the first available treatment that targets the defective CFTR protein and helps to improve lung function and other aspects of cystic fibrosis in patients with the G551D mutation. The discovery of Kalydeco by the scientists at Vertex was made after testing thousands of chemicals in cells containing CFTR. One of those chemicals ultimately became a successful medicine, only it required modification so patients could administer it orally, and so it would last the correct amount of time in the patient's body. Two 48-week placebo-controlled clinical studies involving 213 patients were used to evaluate the safety and efficacy of Kalydeco in cystic fibrosis patients with the G551D mutation. In both studies, treatment with Kalydeco resulted in significant and sustained improvement in lung function. Kalydeco is proven to be a financially viable medicine for Vertex. Its net product revenues in 2012 were $171.6 million, following FDA approval in January of that year. In addition to helping the 4% of cystic fibrosis patients with a particular CFTR mutation, there are currently 3 label expansion studies to determine if the medicine may one day be able to help more people with cystic fibrosis. The American Chemical Society honors these heroes of chemistry from Vertex for their outstanding contributions to science and their service to society.